If you're a nursing student, medical student, or someone interested in healthcare, I think this video is for you. In nursing school, you will hear a lot of medical terms every day. Understanding these terms is really, really important because they help communicate effectively with doctors, your fellow nurses, that's if you're a nursing student, and other healthcare professionals. So, in today's video, I'll be giving you or explaining 10 important medical terms every nursing student must know. I will also explain them in a very simple way so that you can easily remember and apply them, you know, when you get to hear them. So because these terms are commonly used in the hospital setting, okay? So
Welcome back
let's
to
just my channel. My name is Onyi Udoye and this is Onyi Unscripted. The first medical term is diagnosis. Diagnosis simply means identifying a disease or a medical condition by examining the patient's symptoms, signs, and test results. Okay? So, for example, if a patient comes to the hospital with fever, cough, and difficulty in breathing, the doctor may carry out a test, such as blood tests or x rays, to determine what the problem is. If the test confirms that the problem is pneumonia, then the diagnosis would be pneumonia. I don't know if you understand. So, in simple terms, diagnosis is just trying to like know what is wrong with that person, what is wrong with that patient, by trying to like examine the person through what the person is complaining, or let's say through what the person says, okay, through words like, oh, I feel this, I feel that, through symptoms, through signs, and also through test results, most especially because after the person has told the doctor what is wrong with the person, the doctor will need to refer the person to the lab to check what is wrong with the person, okay, so that they can actually confirm. The doctor might sense that this is what is wrong with the person, but they will need to send the person to the lab just to confirm. Then the doctor will now diagnose the person that okay, this is pneumonia. Okay, so as nursing students, you will now know the correct nursing, care to give to that patient, so as to make sure the patient is okay. Okay, so I just hope you understand what diagnosis means. So diagnosis is something you should know as a nursing student because you always hear that in the hospital and you also hear it amongst your colleagues. So the second one is
okay.
prognosis. Now, prognosis is just like when an educated professional predicts, or let's say gives a prediction regarding the likely cause, the duration, and the outcome of a disease or injury, including the chances of recovery or the chances of it reoccurring in future. So it is just different from diagnosis. Diagnosis is just like what the disease is, so it's different from diagnosis. But so understanding prognosis help nurses educate patients and their families on what to expect in future. So the third medical term is acute. Acute refers to a condition that develops suddenly and lasts for a short period of time. As a nursing student, recognizing acute condition quickly is important because it can save a patient's life. Okay. So the fourth term is chronic. Chronic refers to a disease or condition that develops slowly and lasts for a long period of time, usually more than 3 months or years. Okay. So example is you could say hypertension, you could say diabetes. Unlike acute conditions, chronic diseases often requires long-term management and lifestyle changes. Okay, so nurses play a major role in helping patients manage chronic illnesses. Okay, by health education and a lot of things. So the fifth one is infection. Infection occurs when harmful microorganisms such as bacterial, viruses, fungi, or parasite enters the body and causes diseases. Example is example of this infection is UTI, urinary tract infection, tuberculosis, COVID, staph and the rest. So as nurses, preventing infection is one of our most important responsibilities. This is why you practice hand hygiene, sterilization, and proper use of personal protective equipment. Okay, it is really, really important. So the sixth term is inflammation. Inflammation is the body's natural response to injury, infection, or irritation. There are five classes signs of inflammation, which are redness, heat, swelling, pain, loss of function. Okay, for example, when someone has a wound, the area will become red, swollen, and painful. That's like an example of inflammation. Now, understanding inflammation help nurses identify infection or tissue damage early. So the seventh one is vital signs. Vital signs are measurements that shows the basic function of the body. Okay, how am I going to put it? Yeah, example of vital signs is just like checking the patient's temperature, the patient's pulse, respiration, pressure. These measurements help nurses determine a patient's health condition. Monitoring vital signs is one of the most important nursing responsibility. Okay, this vital signs like is something the nurses do. That's like the first thing the nurses do when they see a patient. They'll first of all check the vital signs. Okay, so if you're a nursing student watching this video currently and you are not, or you're about to enter nursing school, or let's say you just started nursing school and you don't know what vital signs is, just know that vital signs is just like measurements to check that patient, if the patient, just to assess the patient, if the patient is actually okay, like internally, if the patient is okay. That is the first thing a nurse do, checking the vital signs of patients. So when you hear vital signs, I hope you not be confused. So the eighth medical term is hypertension. Hypertension simply means high blood pressure. Okay, it occurs when the force of blood against the wall of the arteries is consistently too high. Okay, hypertension is often called the silent killer because many people don't have symptoms until complications occur. So if it's not properly controlled, it can lead to stroke, disease, or heart failure. Okay, so nurses help manage hypertension by monitoring the blood pressure and educating the patients about healthy lifestyle choices, what the patient should do, how the patient should do, and a lot of things. Okay, so the ninth term is edema. Edema refers to swelling caused by excess fluid trapped in the body's tissue. Okay, sometimes it's commonly occurs in the feet, ankle, leg, and edema can be caused by conditions such as heart failure, kidney disease, liver disease. Okay, so as nurses, you assess edema by observing swelling and sometimes pressing the skin to check for pitting edema. Pitting edema is like, let me just give an illustration. Okay, like let's say the person comes to the hospital with a swelling on the leg. When you press the skin down and it doesn't come up like almost like immediately, it just goes down there and leaves like a hole, a kind of like hole. That thing now is what we known as pitting edema. Okay, that is just like how I can explain pitting edema to you. Okay, so you can just go online and check more about it to understand better if you don't understand this illustration I just made. So the last one, which is the 10th one, is the 10th medical term is anemia. Anemia occurs when the body does not have enough healthy red blood cells to carry oxygen to the tissues. Now, common symptoms of anemia include fatigue, weakness, pale skin, shortness of breath. So one common cause of anemia is iron deficiency. So nurses help manage anemia by monitoring patients, encouraging proper nutrition, and administering prescribed medication. So understanding these terms will make it easier for you to follow lectures, understand patients' conditions, and communicate effectively when you find yourself in the hospital. So if you find this video really helpful, please don't forget to like this video, give me a thumbs up, subscribe for more honest nursing contents, and share this video with other nursing students who will find it useful. Thank you for watching. I'll see you guys in my next video. Bye.